Hi, my name is Shikha Moses. I'm a nurse practitioner here at Health Horizons.
What are some treatments that you might recommend for men's health when they face low libido?
For low libido, we kind of do a workup on doing some blood work to see where things are. It could be that maybe they're not living the healthiest lifestyle and they have some plaque buildups, or their energy is not there because they're not exercising or eating well, or maybe their stress is really high, or they're not sleeping good. So there's a lot of different things that happen. But if everything is aligned, it might be that their hormones are out of balance. We do blood work to see where things are at and if we need to move further with the treatment.
You mentioned looking into hormones. Can you elaborate on that and what the process looks like?
Yeah, first we have people come in for an appointment to kind of talk to us about what their symptoms are, because symptoms of low hormone can be a lot of different stuff. Their energy is not as good as they used to be, or maybe their mental clarity is not good. People can have weight issues, anxiety, depression, sleep problems. Their hair can fall out or be thinning. People can have joint pain, migraines, headaches. A lot of those symptoms that they have, they just don't feel good. Sometimes it's, kind of starting in their 30s, sometimes a little bit later, that they just, all of a sudden it's like, hey, I used to feel good no matter what I did, and now I don't feel good anymore. So,
can you talk a little bit about what are the potential benefits to the HRT and maybe some of the risks that they might?
Yeah, some of the benefits, majority of the people that we see that there's a big difference in their energy and motivation, that I've always wanted to take up running, but I've never had the energy to do it, or I've always wanted to go to the gym, but I don't have the motivation to do anything, or yes, I would like to cook my own meals, but I don't have the drive to do all of that. It just helps them kind of take that step forward to be able to do the things that they've always wanted to do. Or maybe, talking about libido and stuff, like I've had people say, that it's saved my marriage because, that's sexual health is such a big part of their life. And their body wasn't able to give them what they needed, so it just needed some extra help with hormones. There's lots of benefit to it. When people sleep better, or maybe their stress is better and have more energy, then they tend to be a little bit nicer and trying to do more good things in their lives. Some of the risks, we do go over that at the first appointment, where we go over if they do have risk factors like family history with any kind of cancers, making sure they're up to date with their like colonoscopies or physicals and all of that stuff, because we definitely don't want to, if there is something going on, we don't want to make things worse, but we do go over risks.
So you mentioned sexual health. Can we touch on topics, maybe ED or things that men might be facing and how we specialize in that?
I like to think that we look at it through the whole person, because you might have ED and go to a urologist and they are only going to look at one thing. We do a heart test and we look at, okay, how is your circulation? We look at hormones and say, okay, how's your hormones? We look at your, do an in-body scan where we look at how's your fat to muscle ratio, and maybe we need to work on, losing some fat. There's lots of things that we address it through to try and get whatever it is that's causing them to have issues, and trying to get to the root cause of it to fix it.
We offer lots of supplements here. One in particular comes to mind is DIM. How would you recommend utilizing that supplement with some of the other things that we've talked about, whether it's men's health or hormone therapy or
DIM is a really good supplement. It's made of mostly broccoli and pomegranate extract, so they call them like the cruciferous vegetables, and it has three servings of those things in one capsule. For men, we tell them to take it twice a day. What it does is it's trying to optimize balance of the hormones, because there's good estrogen, bad estrogen, and total testosterone, free testosterone, and things that it can convert to. So it just helps to kind of maintain a good balance of hormones. So that way, whatever hormones we do give you, you can use it to the best of your ability.
Okay. Can you talk about one of the big causes that men complain about, breast tenderness?
So the breast tenderness, going back to the estrogen part of it, if they have an unhealthy balance of estrogen, then they can have that. And if, one of the times if we do start testosterone replacement therapy, and if it can turn into estrogen, then people can have some breast tenderness there too. So we do have, supplement-wise, we have that DIM that can help with that. If we need to, then there's some medications too that can help them,
Awesome. Is there anything else that you can think of as far as men's health that you see or treat on a daily basis that really has made a difference in your patients' lives?
I think men usually don't talk about their mental health. Like if they have anxiety or depression, it's kind of really shoved off. That's the thing that I've seen the most improvement in people, is where their mood and just the way they live their life, it's so much different when their anxiety is better, or maybe their depression is better, and it leads them to live a more healthier lifestyle, and they just feel better overall because they're not just feeling draggy or crummy.